Hi, I'm happy to be here today with my guest, Will van Derveer on Ketamine Stories. I'd like to introduce him. I'm very excited for him to join us. Will van Derveer is the medical director of Integrative Psychiatry Centers, which offers ketamine-assisted psychotherapy. Will also founded an institute to teach physicians how to work with integrative medicine called Integrative Psychiatry Institute. Will, thank you for joining us this morning.
Thank you so much for having me, Gita. Pleasure to be here.
I'm really excited to have you talk about your own experience because I know how much you work with ketamine-assisted psychotherapy and also psychedelics in general, because I know you've been very involved with MAPS too. Isn't that right? You have a background working
That's right.
Could you tell us a little bit about your background with psychedelic work?
Sure. So I was kind of a skeptic about psychedelics until I got a call from Marcella Delora to inviting me to, or asking me if I'd be willing to be the study physician for an MDMA study in Boulder. This was about a little less than 10 years ago. And, I had read about holes in the brain from MDMA, and I was, kind of brainwashed and didn't really know how effective psychedelics could be in mental health. And so Marcella invited me to read the 2011 paper that Michael Mithoefer had published about the results they got with the MDMA protocol with a small group, about 20 people in the study, but they reported 83% resolution of PTSD in their protocol, 5-month protocol. So I was, having been a psychiatrist for a number of years and never being able to approach anything close to that with chronic treatment-resistant PTSD, I was very intrigued. And so I met with Rick Rick Doblin, and he sort of convinced me that everything was going to be okay, and then it was all on the up and up, and it was all FDA approved and DEA approved. And so I jumped into that work, and it was an incredible privilege to get to work with patients on MDMA in the study. And we finished that study in 2018 and published the paper, and that was one of the phase 2 trials that led into the phase 3 studies with MAPS. So as I moved through that experience with MAPS, and I saw the incredible rapid resolution of PTSD symptoms with MDMA therapy, I naturally wanted to find something I could work with legally for my patients in my clinic, because I still had a busy clinic and I had lots of people who needed a lot of help. So it was around that time that I heard about ketamine as a tool for psychedelic psychotherapy. And in the spring of 2017 was a really kind of intense time in my life, where 19-year relationship was falling apart. And there was a MAPS training in May of that year here in Colorado. And we had a large group of MDMA therapists gathered here with Michael and Annie Mithoefer and Bruce and Marcella. And we were training with holotropic breathwork. And Julian Andrus was my partner in the breathwork, and we took turns. And this is a really intense experience. It's, obviously Stan built this as a substitute for the LSD experience. So
could I interrupt you? So you could just,
Sure.
maybe for those who are not familiar with holotropic breathwork, could you explain what that is?
Oh, sure. So, and you can hear Stan talk about this on YouTube. It's really easy to access videos of him talking about it. But so Stan Grof, the, really quintessential psychedelic psychiatrist from the Czech Republic, was involved in LSD research in the 60s. And when LSD went on Schedule 1 in 1970, he came up with an alternative to produce an altered state he felt similar to the LSD effect. And it was something that could be used to as a catalytic experience to open people up. And in particular, Stan writes a lot about how holotropic breathwork can put people in touch with the very earliest perinatal and prenatal experiences. And so, because birth is such a life and death experience, and it often is traumatic, and it's very medicalized, and westernized countries, there's usually a lot to work with in terms of prenatal and perinatal material. And this subconscious material is usually very well hidden from ordinary states. So working with early attachment trauma is difficult to access as a therapist without the use of a catalyst or something that, like holotropic breath work or MDMA therapy or LSD therapy in the case of Dr. Groff's work. So holotropic breath work was created to simulate this state. And the way it works is, and I'm not an expert in it, but my experience of it was that loud music and rapid breathing with eye shades on in a group setting produces somatic experiences and emotional experiences that can be extremely intense, which again Stan felt was the emergence of oftentimes perinatal experiences, perinatal trauma experiences.
Thank you for that summary, Will. That was really well done. So let's go back to your own personal experience. What happened for you?
Right. So I remember my ex-wife, who was my wife at the time, and I had a difficult conversation, and then I went into the holotropic breath work, which might have been a really challenging moment to start opening up early experiences. But in any case, this has often been the case in my life. I just dived straight in there, and with the holotropic breath work, with this really loud, intense music, I started to kind of writhe around on the floor, and I started to feel really intense anger, and I started shouting, and that led to a big emotional release and a lot of crying and a feeling of being cracked open, and in a certain kind of way not wrapped so tightly as I usually am in my ordinary life. Mm-hmm. Almost fractured, I think was the word that I used at the time. It felt like there was a lot of grief happening at the end of that long relationship with my ex, and it was starting to come through. So right after that, I had previously scheduled with some friends of mine who are psychiatrists a ketamine training. Mm-hmm. And so about a week later, I was in this ketamine training, and the people leading the training recommended that we take a much higher dose than intramuscular dose than what I have ever given a patient in my practice. So, and we did this 2 days in a row. And I thought after the first experience that I had, and this is my first experience with ketamine, this very large intramuscular dose, I felt a little off. I felt a little off center and like I'd lost my balance somehow. And I wasn't sure if I was going to participate in the second round of the experience. Mm-hmm. But I was there, and I thought, well, here's my opportunity. And I kind of felt a little better that morning. So I said, okay, I'm going to do it. But I told the couple who was training us, I asked the woman in the couple who was training us to, if she would be willing to sit on the floor and hold me as I underwent the ketamine experience. For some reason, it seemed like that was a good idea because I was feeling vulnerable and kind of tender. And so she agreed to do that. And I'm bringing this up because it turned out to be a really important part of that ketamine experience was that as the ketamine came on, I could feel, I couldn't really hear, but I could actually feel the breath of the facilitator on the side of my face, my ear. And for some reason, it really connected me into the experience of being a child in the lap of my mother. Mm-hmm. And so I began, it took me a long time to integrate and understand what happened later, but the next thing that happened was coming out of the ketamine, I noticed myself feeling like I am not going into this body. I refuse to be incarnated. It's too hard. The human experience is too difficult. I don't want to do this. And I got into this really intense opposition to what was really happening. Was my consciousness was coming back into my body, and I was refusing it. And refusing it was creating a massive amount of tension and difficulty in the experience. And then I could feel the facilitator holding me as I came into my body, and that helped to reassure me to some degree. But it was as if I was remembering how hard it was going to be in the early childhood experiences I had before they happened. Does that make sense? It's hard to
Yes.
describe.
It sounds like almost a future memory from an earlier time.
Exactly. Yeah. And so what happened after that was the next day the training ended, and then I noticed that I was feeling just a little bit off. I didn't feel like I fully came back into myself. And it was a scary feeling because I think everyone, who's ever considered doing a psychedelic, or maybe even anyone who's done a psychedelic before, has the concern of, well, what if I break my mind, or what if I never come back, or have a psychotic break, or something bad happens to me. So it took it took a while. It took several days for me and I had really good support, and I didn't have to work or see patients, which was really good. And so then there was a lot of integration work with my somatic psychotherapist who I see back home. And what came out of that was a really powerful conviction from my own experience that ketamine was an amazing tool to work on attachment trauma and attachment injuries of all kinds. I later found out that the story of my childhood was that my mother and I came home from the hospital after I was born together, and she had a bleeding blood vessel internally that no one knew about. And so she had an emergency where she nearly died and had to be rushed to the hospital for surgery. And at that time, I was left in the care of my father, who was an alcoholic, kind of very young, 21-year-old man who was very ill-equipped to take care of a baby. And so at the end of the first week of my life, my father came to pick up my mother up at the hospital, and I wasn't in the car. This is what my mother told me later. And she said, "Where's the baby?" And he said, "Well, I left him in the apartment." And I told the neighbor that if she heard the baby crying, that maybe she could go check on him.
Oh my goodness.
So I think I had that kind of experience in the first week of my life, and I think it was pretty jarring. And I think that what happened in that ketamine experience, those 2 times in a row at a very high dose, was that it uncovered something really intense that I didn't even know. I wasn't aware that that was such a big factor in my life. And I'm sure it was a big factor in my marriage that failed.
It's such a beautiful story. Thank you so much for sharing it. It's a very personal story, very painful story, but one that has a really good outcome. It sounds like you really did have the supports to, while you were modeling through understanding, to sort it out.
Yes. And it turned out to be incredibly fortunate that happened, because one of the things that was happening throughout that year of 2017 was I'd been studying Stan Tatkin's work about secure attachment, and Dan Siegel's work around earning secure attachment. And I had become convinced that secure functioning in my life as an adult with an adult partner was a possibility, that I could actually have that in my life. And I became committed to it. And I think that if I had not been able to delve so deeply into the early trauma, I wouldn't have actually been able to manifest that in my life, which is what ended up happening. It was a busy year. So I went at the end of August, I was at Burning Man, and came back. That was an incredible experience, my first time at Burning Man, and then came back, and that's when my ex-wife and I said, okay, well, we clearly want different things. We had a little ritual of completion, and about 3 days later, my best friend called me and said, I want you to meet this woman. And I said, I'm not ready for that, and he twisted my arm. And so I took her out in November of 2017 and explained the kind of relationship that I was committed to having in my life and what I was looking for. And it turned out she was looking for something very similar. And Krista and I fell in love, and a year ago we married, and now we're doing this ketamine work for couples. So the work of that experience, of that ketamine training, and how fracturing and how difficult that moment was in my life, really turned out to be an incredible turning point and a huge gift. And part of what happened with the later unfolding was that Krista and I, Krista has this way of opening me up to, what do I want to do in the world? What's my gift? What do I want to give the world? And I realized that even though I had been teaching integrative psychiatry for a number of years with Scott Shannon and other friends in weekend workshops, I felt like there was a seed in me that wanted to sprout into something much bigger. And so that's where the Institute was born out of, was this desire to train 10,000 practitioners in the next 10 years and really bend the arc of, the huge problems that we have in mental health care, and how we think about pharmacology as a solution, and we don't really look for root causes of depression, for example, or bipolarity, or we don't adequately screen for trauma, and we don't have effective trauma protocols, many of us.
It's such a lovely story, your personal story that you share with us, Will, because it certainly really illustrates so beautifully how your own healing that occurred, it sounds like largely inspired or catalyzed by ketamine, has really informed your creativity in the world, both with your use of ketamine, what I'd love to hear about, and maybe we could first start off with your work with your integrative medicine teaching. Could you tell us more about how do you think of integrative medicine, particularly as it pertains to psychiatry?
Thank you for asking. It's a big passion of mine.
Yeah, I can hear that.
So for me, integrative medicine and psychiatry is about making a commitment to go as far as you can to find the root causes with your patients. And it also means mitigating symptoms and making people more comfortable as you go through the process of finding the root causes, if possible. It started for me in 2004 when I had been out of residency for a couple of years, and I was using the tools that I had learned, like CBT and medication management. And I had a lot of people in my practice who weren't responding to the usual treatment as usual. I later found out, with STAR-D and some of the other studies that came out later that showed that the limitations of medication, why I was having so much problems with getting people to respond to medications. So at that time, in about 2 years after I graduated residency, I was so frustrated that I actually quit psychiatry and I went on a year-long meditation sabbatical.
Wow.
And
you were that discouraged.
I was very discouraged. Yeah. I wasn't sure I was going to come back to psychiatry. And then I ran into a patient who I had been working with very intensively once a week for therapy, medication, meditation. We'd done everything I knew how to do at the time, which in retrospect wasn't a whole lot that I knew how to do. But he came up, I ran into him on the street, and he came up to me and he said, look, thank you for supporting me. I want to let you know that after you took your sabbatical, I saw a naturopath, and I got tested and was diagnosed with celiac disease. And when I stopped eating wheat, over several weeks, my anxiety melted away. And then I went off the SSRI and the benzodiazepine that you had me on, and I still had no anxiety. And it was the first time this guy had crippling panic attacks. He couldn't travel. He couldn't date. It was really intense. So it was a huge wake up call for me that there were things I didn't know about what could happen in the body, for example, that could cause this kind of anxiety, and that there was a simple, elegant, the removal of wheat was what changed his life. And to be a practitioner and, to be board certified in psychiatry and to not ever have heard about, the possibility that diet could have such a big impact on mood or anxiety or insomnia was a big revelation to me at the time. So that kicked off a whole series of going to CME events and learning about the gut brain connection and the role of hormones and the role of inflammation,
Mm-hmm.
how to resolve trauma with better tools. I trained with Peter Levine in somatic experiencing, which was incredibly powerful.
Mm.
And so over about 10 years, I put together a kind of toolkit that I was using in my practice. And so the Institute is really about trying to deliver 10 years worth of cobbling it together on your own into a 1-year training with 40 or 50 faculty and getting all the data. So it's all evidence-based information so people can relax and know that, they're operating within the evidence-based medicine.
Right.
So that's kind of the more the functional medicine side of it. But then there's also
Yes.
the psychological of, trauma resolution, spirituality as a healing element of mental health care. And then there's, of course, lifestyle medicine like diet and exercise and sleep hygiene and all of that stuff. So those are the things that I think are the elements of it.
It sounds extraordinary. It sounds very comprehensive
Mm.
and very well done, and such a beautiful offering in the world. I wanted to bring you back to the way you use ketamine, because I know you use a lot of ketamine assisted How do you use ketamine in your practice? Maybe I should ask you more generally.
Yeah. So we provide intravenous ketamine and intramuscular ketamine, depending on the situation. Most of our work now is intravenous ketamine. Every person who comes to our clinic gets psychotherapy with the ketamine. There are a few rare instances where someone can't afford the psychotherapy fees, and so we might work with them if they have an outside therapist. But 99% of the people who undergo ketamine treatment with us have a psychotherapist who's in the room with them for 2 hours.
Mm-hmm.
And we do twice a week sessions for 3 weeks. So it's that kind of more intensive ketamine approach. Yes. And then we work with them with these integrative psychiatry tools to prolong the benefits of the ketamine. So we try not to have people end up in a kind of a ketamine maintenance program, which doesn't happen very often actually in our practice, which is
wonderful.
Great.
And I've heard you talk at various conferences a lot about the unique work you do with ketamine in couples. Could you tell us a little bit about that?
So the couples work is really fascinating. It was born out of this experience I just shared of having the facilitator at my ketamine training hold me in her lap while I underwent the second ketamine experience, and the comfort that I felt of having kind of conflating her breath with my mother's breath as an infant, the kind of blending of the present and the past that can happen with ketamine.
Sounds a little bit like fusion therapy that they used to do with LSD. Right?
I don't know much about that. Yeah.
But it's so tell us more about, you said it's more to try to recreate the early attachment with your partner. Could you say more about how you do that? Right.
So our protocol is a blend of Krista's skills and what I bring to the table with the ketamine assisted psychotherapy work. So it's a series of preparation sessions where we invite the couple into a bigger vision of who they are as a partnership, which is a big part of what Krista's background has been, is working with groups and individuals who are trying to create a bigger vision in the world, who need to learn how to cooperate with better relationship tools, communication tools. So most couples haven't really ever thought about, well, what are we up to in our partnership? what is this about? Is it about raising conscious children? Is it about philanthropy? Is it about uh, you know, creating change in the world? Is it what is it? What's our mission? What's our purpose as a partnership? So that's a really interesting investigation. And
Definitely.
part of why we start with that is because it actually uh, becomes a lot easier to deal with conflict if you're working towards something together. And then you can see the obstacles as being something that's on the way rather than something that's in the way. So we work with them for a few sessions to prepare that and to also really understand what the conflicts are and where the attachment injuries lie. Because for couples who are in big trouble, the kind of couples that we work with, there's almost always identifiable childhood trauma or attachment trauma involved.
Mm-hmm.
It's sometimes people downplay it. In my own personal case, I wasn't aware that something so deep was inside me. So obviously, it can be hidden. But we
Do the,
work. Go ahead.
I'm just wondering, how does it even work? Do you take it in turns? Like, are there two sessions? It
Oh
sounds,
yeah.
how does it
So
actually?
so then when we get to the actual session, it's a 5-hour experience. So we meet at the clinic and you know, vital signs and all, you know, the medical screening, and then one person chooses to go first, and the person who undergoes the ketamine first lies in the lap of the partner.
Mm,
And so as you come back into your body on the ketamine, you're looking in the face of your beloved. And this brings up pretty reliably this kind of fusion that we were just talking about of
mm,
the defenses coming online and the expectations of what's possible in a relationship come online. And then we spend an hour discussing that. And then we switch the roles. And then the other partner has ketamine in the lap of the other person. And then we
mm.
spend an hour debriefing at the end. So it's a longer experience.
That sounds very, very powerful.
Yeah, it's been really wonderful to hear people talk about how transformative it can be.
And you and Krista certainly seem to be representative of another dynamic couple pair in the psychedelic work. It sounds like you really enjoy working together and using your skills, um, your complementary skills together.
Well, it's an expression of that desire to have a partnership that is about doing healing work in the world or transformation in the world, and not only for our own private pleasure or relaxation together.
That's wonderful. We only have a few minutes left in this interview. You have so many interesting insights and knowledge to talk about. It's very hard to keep it short. But I was just wondering in the last few minutes if you could share with us some of your musings on consciousness. You've obviously had a lot of personal experience. You've worked in many different capacities with different medicines, and are very thoughtful and thought. I'm wondering, what do you think about consciousness? How do you make sense of consciousness?
Well, I had a period of time in my life where I was a very devout Tibetan Buddhist and meditating, you know, for uh, hours a day and a
Mm,
lot of solitary retreat. And I had a certain perspective on consciousness from that
mm.
before I had had any experience with the MDMA training
Yes.
study and taking ketamine from that and the ketamine experiences. So I think the ketamine is the thing that to me feels the most, in my experience so far, the most complete of a temporary erasure of the ego. It's sort of this raw experiential presence that is palpable, but without a sense of perspective or even a sense of location, which is something that my Buddhist teacher talked about a lot and I learned about a lot, but I can't ever say that with meditation I ever felt that completely
Yes.
in the way that ketamine sort of like a tsunami just kind of wiped out who any sense of self, any sense of personal perspective for a period of time. Um, which is really, it's a very powerful experience and it can be really scary to have it come on that
Mm.
way. in sort of a chemical way so quickly. So I think for me, consciousness feels everywhere. And so it feels beyond space and time.
Mm-hmm.
Uh, in ordinary life, in my clinical work, in my teaching and research, I'm very much in the personal self all day, every day.
Mm-hmm.
And oftentimes it feels like too much so. Default mode network's a little bit tight.
Sure.
And so I think experiences that soften or open that sense of neuroticism are really valuable for me.
It's been such a pleasure to talk with you today and hear your thoughts and to hear your story about how much ketamine has really opened you up and just allowed you to bloom all of this incredible work and knowledge into the world. Thank you so much for being with us today.
Thank you, Gita. It's wonderful to be with you.
Thanks.